I wanted to talk to you today about fertility. It's a big issue in a stress-filled society. And oftentimes there are many, many different components to infertility. Sometimes it happens to be related to difficulties in the reproductive system itself in terms of ovarian function. And Ayurveda has a number of different ways to deal with difficulties with ovarian function, which, oh, by the way, will produce menstrual difficulties. And menstrual difficulties then leads to a whole array of different difficulties with menstruation, with ovulation. And so these issues can all be addressed by Ayurvedic lifestyle techniques, by methods that help produce a normal ovulatory patterns, because that, in essence, is the issue of the infertility oftentimes in and of itself. But the other issue that I think is really important is that sometimes women have problems with just functioning sexually. And the reason for that is because they happen to have pelvic nerve irritation, which then leads to referred pain that leads to painful intercourse. And this painful intercourse can then lead to quite a significant dysfunction, such as what's called vulvodynia. And vulvodynia, or painful intercourse for women, can be a significant problem in terms of functional disability. And it's not well understood in the West, but Ayurveda has a very deep understanding of this kind of problem, and can lead to a lot of, give a lot of advice that can bring about a return to normal function. The issue is that all these problems that Ayurveda addresses takes time. And the longer you've had this problem, these problems, the longer it will take to deal with the issue at hand. But there are many, many tools that can be used in order to help deal with these problems that are really ineffectively done and dealt with in the West. The allopathic tradition, the matter science discipline in the West, really doesn't have answers to many of these problems. It has molecular tests to be able to look at these issues, but they don't really have a method of dealing with the problems, because it all comes down to energy, the energy imbalances that are created by the physiology because of wrong diet, because of wrong lifestyle, and wrong food combinations, lack of exercise. All of these issues play a role in creating the imbalance that then leads to the infertility. So Ayurveda is not just saying, oh, it's the magic bullet of a molecular solution. The solution is oftentimes not molecular. It is energetic in terms of its solution, especially with chronic ongoing issues that we are confronted with on a daily basis. That is the power of the energy science discipline, to be able to go to a deeper level of understanding of disease, because the deeper you go in terms of the level of understanding of disease, the more you're going to get to the root of the problem.